Korea's superweapon against pandemics? Artificial intelligence. Hi, I'm your host, Dr. J.R. Reagan. In this episode, we'll be discussing how South Korea is battling COVID by arming itself with a new potent weapon, artificial intelligence, or AI. Since the onset of the outbreak in January of 2019, Korea has tackled COVID using a combination of technological prowess and bureaucratic acumen. After the SARS outbreak in 2003 and more recently MERS in 2015, the South Korea government prepared for the inevitable outbreak of new emerging infectious diseases by reforming the epidemic preparedness system. It forced the country to reassess its approach to infectious diseases. It has adopted a test, trace, and treat, or 3T system to curb the spread of the outbreak in order to meticulously track the contacts of people with COVID-19 and treat them at the earliest stage. But there's a lot more to the success. The Central Disaster and Safety Countermeasures Headquarters stated that the agency considers two core values very important. The first is that public participation must be secured through openness and transparency. The second is to respect creative thinking and use cutting-edge technology to develop the most effective means of response. Under the Infectious Disease Control and Prevent Act in South Korea, the public has the right to be informed about all developments and responses in disease control. Not only are government briefings held on the outbreak twice a day, but the law also enables related authorities to access a wide range of information resources. Information is shared with the public through an interactive website and daily text messages. Authorities are also able to trace the movements of infected persons via mobile phone location information, credit card usage, and data mining of CCTV footage, then publish extremely detailed information about their whereabouts, even down to which seat they sat in at a movie theater. This information is anonymized and made available to the public via apps, which in leveraging GPS allow persons to avoid areas infected people have frequented. This policy plus technology approach towards combining science, technology, and medicine is enabled by the recognition of the positive role new technologies can play in both the public and private sectors, including big data and artificial intelligence, or AI. Notable examples of this can be seen during the COVID response. Korean telecom companies have used AI in a healthcare service that keeps track of coronavirus spread in real time. This allows authorities to track people's movements and contain further spread of the outbreak. Information on patients who tested positive for COVID-19 are easily accessible by people within the vicinity through mobile alerts anonymously. Travel history, activities, and commute maps for the last 2 weeks are also indicated. In another example, Seegene, a molecular biotech company based in the capital city of Seoul, fast-tracked the development of its COVID test kits in only 3 weeks thanks to AI. The company started focusing on COVID virus research in January 2019 after the outbreak was first reported in China, but before any cases were confirmed in Korea. It was able to quickly develop its test kits by using an artificial intelligence-based approach, even though it only had genetic data about the virus and not a viral sample. Seegene was also able to quickly garner support from the South Korean Centers for Disease Control and Prevention within a week, rather than the more typical year and a half. The company also then redirected Seegene workers to the assembly line to ramp up kit production, putting other work on hold. It is now exporting the kits to over 42 countries. One of South Korea's largest telecommunications companies, Korea Telecom, or KT, is also using AI to tackle COVID. It is developing a COVID-19 infection risk assessment model using artificial intelligence and big data for advanced digital contact tracing. For the pilot project, KT plans to assess COVID-19 infection risks by using AI and big data to analyze data on the movement of smartphone users and those who have been tested positive for the virus. KT expects the risk assessment model, based on identification of those who have been exposed to carriers of the virus directly and indirectly, will help prevent further transmission of the COVID-19 pandemic while minimizing the risk of personal information leakage. It also expects to be able to identify vulnerable high-risk groups in case of new waves of the pandemic or group infections, and promote an effective use of limited medical resources such as medical personnel and test kits. KT initiated the pilot project with support from the Research Investment for Global Health Technology Fund, better known as RIGHT Fund. RIGHT Fund is a global health research funding agency established in 2018 with contributions from Korea's Ministry of Health and Welfare, the Bill and Melinda Gates Foundation, and Korean life sciences companies to promote global public health. There are plans to use the pilot project results for larger scale global use beginning in 2021. KT's project will help developing countries which are faced with a shortage of medical resources to prevent the pandemic from spreading and conduct appropriate examinations and treatments. Through the research, KT plans to further upgrade its Global Epidemic Prevention Platform, GEPP, focusing on providing information on infection risks of contagious diseases and digital contact tracing. GEPP uses big data and social media to give updates to travelers going to countries hit by epidemics and to track the movement of infected individuals. At the same time, KT will help reduce the gap in the provision of medical services among different regions and different income groups in underdeveloped countries, using its information communication technology and digital capacity for research and development on health. In another example of AI for attacking COVID, the Korea Advanced Institute of Science and Technology, or KAIST, announced that it had developed the High COVIDNet, which is an artificial intelligence model capable of predicting the 2-week number of COVID infectees entering Korea from abroad. The institute says that its prediction is 35% more accurate than the prediction results of existing AI models based on deep learning and time series data. High COVIDNet uses big data and AI in calculating the number of potentially infected persons predicted to enter South Korea for the next 2 weeks. The data includes the current numbers of COVID-19 infectees and deaths in various countries, the frequency of COVID-related keyword searches in each country, the daily number of flights, and the number of roaming mobile users entering Korea. The data on infectees and deaths depends on the number of tests conducted in each country, and as such, the Institute has also employed the keyword search frequency as input data so that the level of risk in each country can be calculated in real time. The AI model uses geographical correlations of countries too. Specifically, it accurately predicts the number of infectees from each continent based on geographical hierarchy consisting of countries and continents, and the prediction results are used for even more accurate overall predictions. AI is also being used for improving diagnosis efficiency and patient classification as part of the risk mitigation strategy by the KCDC, or Korea Centers for Disease and Control. In one example, a chest X-ray AI image support decision tool, an algorithm for identifying abnormal findings on chest X-rays, classifies intensive care patients by using X-ray images and can examine the lung within just 3 seconds. The tool can also be used with a handheld AI-based chest X-ray camera, which can scan the chest in also just 3 seconds and give a heat map visualization of abnormal lesions. But amid Korea's struggle with the COVID-19 pandemic, the elderly face particular challenges, and not just from the disease. In this critical situation, Korea is also using AI to monitor a potentially growing lonely elderly population. Using AI and big data, the search habits of thousands of South Korea's senior citizens is able to be monitored by voice-enabled smart speakers. In an experimental remote care service project that the SK Telecom company says is increasingly needed during the coronavirus crisis. Seniors are closely screened for signs of danger, monitoring whether they are more frequently using search words that indicate rising states of loneliness or insecurity. Trigger words lead to a recommendation for a visit by local public health officials. The speakers are built with an artificial intelligence called Aria, and a lamp that turns blue when processing voice commands for news, music, and internet searches. The devices can also be used for quizzes to monitor the memory and cognitive functions of elderly users, which would be potentially useful for advising treatments. Around 3,200 people across South Korea, mostly older than 70 and living alone, have so far allowed the SK Telecom speakers to listen to them 24 hours a day since the service launched. With privacy concerns also being highly monitored, the technology has reduced human contact in welfare services while still providing governments with a tool to prevent elderly residents from dying alone. This is especially needed in a country grappling with an aging population and high poverty rates among retirees. As circumstances continue to be hazardous across the world due to the coronavirus pandemic, South Korea continues to showcase innovative approaches to a strong public health response in containing the COVID virus and providing methods for the rest of the world to learn from. AI has truly emerged as Korea's superweapon against pandemics. That's all for this week's show. Follow me on Twitter or LinkedIn at Idea Explorer or my website ideaexplorer.com. Feel free to leave comments or suggestions about the show and tune in next week for more news and trends about Korea technology.